Hey there, it's Clair Campbell with Campbell and Associates. We're going to take a couple minutes and I'm going to give you the Campbell scoop for the day, and we're going to talk a little bit about permanent injury as it applies to recovery in a personal injury case. Often you are in a fender bender, you have some soft tissue injuries, and you get treated by maybe the emergency room first, your primary care physician, a chiropractor, physical therapist, orthopedist, neurologist, and 6 months go by, you're feeling great, you're back to work, you're doing everything you want to do, no permanent injury. Same scenario, you may have some lingering residuals, aches and pains with all of that that's been treated, but you're 1 on a 10 scale and still have days when there is something that crops up. That, in the scheme of things, is not considered a permanent injury. It may be something that you deal with lifelong, but it doesn't prevent you from doing things, and it doesn't restrict you in any way or change your lifestyle other than that residual pain. For us to be able to make a recovery under the permanency guidelines, an impairment rating is required by your doctor of the particular body part that is damaged, and that permanency impairment rating is a percentage of what you've lost. And assuming we all have 100% to begin with, if you get a 10% disability rating on your arm or your back or your leg, then that 10% is worth money to you in a personal injury action, because that is 10% that's gone forever, that doesn't come back with time, that doesn't have any medical way to heal itself. And most doctors will tell you after a year the body is going to do everything it can to repair itself with help on your own, exercises holistically, etc. But after that year, if things are still hanging around, the likelihood of any great improvement is slim to none, absent surgery or some other invasive means of correction. And even then, most surgeons will give some disability rating to the surgical site just because of the way the American medical guidelines are written. So if you do have an injury and you're assigned a permanent disability rating, that's something that you need to remember to bring up at settlement time, and it's something that will ultimately put some money in your pocket, sadly, obviously, because you'd rather have the use of that limb or back or neck back. But the legislature has recognized definitely that that is a loss that you're entitled to damages for. Ultimately, if you suffer and have been out of work for a year or are expected to be out of work for a year, Social Security disability benefits may also be available to you. So there's a difference between Social Security benefits from a disabled statute perspective and injury benefits from a disability rating under the personal injury system. So this is important. Restrictions that the doctor gives you, that goes along with that permanency. So we look forward to hearing from you if you have any questions, and be safe out there. Take care. Bye-bye.